Hi everyone, welcome to Skill Ninja and welcome to Confab with Mehak. I hope all of you have been doing really well. You spent your week nicely, productively, happily, and did something for yourself because here in Skill Ninja we aim at women doing something for themselves because we help you reach your goals. We help you learn English, your speaking powers that you think might help you in communication in this modern world where English is becoming a very global language. So I hope you are helping yourself with everything, helping yourself with technology, with our Tech Ninja courses. So I hope you are keeping yourself updated and upgraded because this is what we aim at. So moving on towards this topic of confab, we have been talking very much about health because we talked about physical health, we talked about mental health last week, and this week we are talking about the health of your eyes. I hope all of you have been taking good care of yourself because eye flu is around the corner, and let's see what this monster of a flu has to do with us and how it should be prevented and how it should be cured. First of all, we want to know that how it happens and why it comes at all. So today we are inviting Dr. Aditi Sharma, an ophthalmologist and an eye surgeon, who will help us to know that how and why we can combat this eye flu, which is the pink eye, the red eye, whatever you might want to call it. So Dr. Aditi is right here and she'll join us very shortly, and she's here. Hello, Dr. Aditi.
Hello, can you hear me?
Yes, I can hear you. Absolutely. So how are
Hi,
you
good
doing?
evening to everybody.
Good evening. So I hope you've been doing well, Dr. Aditi, seeing so many eye
Yes,
flu patients,
trying to save our own eyes.
yeah. So you have got the eye flu.
No, we have not yet been the victim of this, but we
Okay.
have tried to take care, tried to prevent. It's very difficult, but yes, uh,
So we absolutely want to know from you today that as you have saved yourself until now, how do we, our audience, save themselves from this eye flu that's spreading around everywhere? I think she has a frozen network. So we'll very shortly know from Dr. Aditi that what are the do's and don'ts for the eye flu, what we must do to prevent this, this common flu that's happening, and it's so much, irritating to the eye, and the children especially are coming under it, coming under the influence of it because they are more exposed to, the things around them that are not very clean and hygienic, because going to schools they probably touch everywhere and anywhere, which is not very good for this virus. So let's know from Dr. Aditi that why this eye flu is spreading so much and what can be done about it. I think she had some problem with the network. um, Okay, so this eye flu is, as all of you know, it's not anything new, but it definitely comes in a season. So let's see and ask Dr. Aditi why it has a season, because eye flu probably seems to have a season, loves rainy season for some, I don't know, weird reason. So let's ask Dr. Aditi if there's anything we can do about it so that we can completely prevent it and avoid it. So she's back with us. And yes,
sorry.
Dr. I think it was a network glitch, yes?
Yes, yes.
Okay, no problem. Dr. Aditi, why don't you start with telling us that what exactly is eye flu?
So it is a viral disease, like we were dealing with the coronavirus 2 years back. So it is a similar kind of viral disease, which is very infectious and it spreads by contact. Uh, I would like to just dispel a myth here that it was believed that it is transmitted only by looking at a person who is having the disease, but that is not so. But yes, coming in contact, touching your own eyes after having been in contact with that person, touching that person's eyes, his belongings, his or her napkins, or anything that they have touched, that causes more infection. So that is the main cause what we are dealing with. And yes, one important thing that we saw this time is it is spreading from the children. So the children, when in close contact at school, so when one child has started developing, the whoever are their friends or their teachers or whoever the people are, even with small kids, we have seen that the first case of the family is the child. So with the child now, then the parents, grandparents, everybody got infected. The whole families are getting infected. So the main thing here is contact. So we need, like we used to isolate in cases of any viral case. Isolation is good in which way that minimum contact should be there so as to prevent the spread of this disease.
Right. So yes, that's how to prevent the IQ. Uh, what is the medical name for it, and why do you think, Dr. Aditi, it has this very favorite season? It has a choice of season that comes around.
Yeah,
Why
yeah.
is the so
Yes.
notorious to have to choose a season for itself?
Yeah, so the medical term for this is conjunctivitis, which is inflammation of the conjunctiva, the white part of the eye. And it is notorious in this season when there is a lot of humidity in this cloudy weather. When the rain, it just rains and then it stops for a while, and there is humidity in the atmosphere. So this is the main time in which this virus is, at its best, at its most virulent. That the term we use is virulent. So the what we are having is now an epidemic. Like we had an epidemic of coronavirus, it is similar to that. It is an epidemic of high flu. So this is the season in which the humid conditions give rise to this virus. It helps in its multiplication, and that's why we get infected with this virus in this particular time. If it is going to get very sunny, the clouds will go off once the rains are over, and there is a strong sunlight for around 7 to 10 days. Get that kills this virus. The strong sunlight, continuous sunlight, and the less humidity. And now we have seen a decline in the cases since the last 2 3 days. But yes, it has been almost 10 days of this seasonal eye flu that we have seen this year, and it has been almost in the government hospital we are seeing around 500 cases every day. So that is a huge number, huge number.
Yes, right. So, as you say, the cause is the humidity. So, of course,
Yes,
that's very logical that during the rainy season it's very humid. So, I hope we are going to bid it goodbye with the rainy season, and
yes,
so
soon.
absolutely cool. So, Dr. Aditi, after it happens, I mean, are children more prone to it, or is it just, something that's happened this time that children are being affected too much?
I do feel that maybe after the corona epidemic, all these viral diseases have taken a surge, because previously we used to see cases, but not in such amounts that we are seeing so many cases, 500 daily. Maybe we used to see on an average maybe 100 cases, 200, but definitely I feel that there has been a surge in almost all viral diseases, mainly in children. Somehow children are being affected more, and that is something that maybe it has happened because of our immunity. Maybe we have not been eating well, or we've not been keeping well post viral. Some people do say that once you get COVID, the immunity is also less, and we need to strengthen the immunity. Maybe we need to get some vitamin supplements. We need to eat properly and maintain our immunity so that we don't get infected so very often with these viral diseases.
Right. So immunity is definitely the ruling factor. You must
Yeah.
keep it in for the viral and even the bacterial diseases. So that's very informative, Dr. Aditi. What else do we need to take care of about the eye flu? And is this the pink eye and whatever we call it? So many friendly
Yeah.
names we the virus.
So I would like to just tell some I mean, not even precautions, but see, as a precaution, we should not use eye drops. If we have symptoms, If there is redness, if there is pain, if there is swelling, then we can use the drops, not to be used before developing any symptoms. So that is very common. People start using drops even before they have any symptoms. So there is no prevention. The prevention is just no contact, I mean less contact, and we should not use any drops as a prevention. Secondly, frequent hand wash. Again, we need to repeat the same things that we used to do in COVID times. We need to wash our hands, we need to touch less on the objects, the surfaces, and we need to maybe sanitize our hands frequently if there is, we can't wash our hands frequently. And we need to, you know, we can meet people. There's nothing wrong in meeting people, going to work. There's nothing wrong. But using glasses, that helps, because glasses are are a barrier. So if I am using glasses in my routine, I don't touch my eyes that frequently, because I would remove my glasses and then touch my eye. So, the glasses are a protective barrier. So we do advise, if the people want to wear sunglasses or even plain glasses, that's a good prevention. That's a good method in which we can protect ourselves from touching our eyes. So, and yes, with the season change, definitely things will get normalized soon. And now we are seeing a decline, so that is a good news. But still, we are having a lot many cases. And also, I would like to point out one thing, that nothing to be scared of. See, this kind of viral disease, it is presenting with very, I would say, very florid symptoms. So there is a lot of swelling, there is a lot of redness, lot of pain, lot of discomfort. It all seems very disheartening. Okay, ye kya ho gaya? Eyes are really red and not able to see clearly. It's very disheartening, but I would like to just assure them that it is a normal viral, like a common cold, like a common fever, like a common flu. This is also a flu. It will go. If it'll take around 7 days, but I would just like to reassure that it is not harmful to the eyes. The eyes will recover almost 90%, 95%. They will recover. There's no problem. I mean, we are seeing recovered cases also. The eyes have completely healed. The redness is gone. Swelling is gone. Now they are comfortable. So it just takes a little bit of patience. Once we start treatment, it will take 3 to 4 days for it to act, the medicines to act. So just be patient and just let it be. The wave will just pass, it will just tide over, and things will become normal again. So I would like to reassure everybody who is having conjunctivitis, eye flu at this point, that things will be better. They will get better.
Thank you so much for the affirmation, Dr. Aditi. Coming
Yeah.
from an ophthalmologist, this is the best thing we could have, because please do not
Yes.
something which will come and go, like your cold and flu and cough and
Yes.
fever will come and go. Yes, it will take
Yeah.
7 days to
Yes,
completely.
it will do. It will.
Yeah. So it's going to take at least 5-7 days to completely recover.
Yeah.
Also, Dr. Aditi, very nice of you to throw light upon the myth that wearing glasses and how it protects. It only creates a barrier. That's all. I mean, there's nothing like you wear glasses and you cannot transmit it. I mean, it's the
Yeah.
yeah. Because people commonly have this myth that just because you're wearing glasses, now you cannot infect anybody. But if you're still touching your eyes,
Yeah.
area around your eyes, and then it can still spread. But the whole
Yeah.
point of wearing glasses is that you're not touching them so often, and then it's not spreading so often.
Yes, exactly.
It's very nice of you, and I think there's not much more to this eye flu that we talk about. There's one more thing. Now that you're here, we would want to know about the LASIK surgery. That's very popular these days. If you have some
Yes.
power and people want to immediately get operated and get rid of their glasses, what would you say about that, Dr. Aditi?
So LASIK surgery now, it is very advanced. It has started around 20-25 years back. And now the techniques that are used are very precise. And there are definitely techniques that we would prefer, anybody can go for it. But in what we prefer is, there is an age criteria. So if the patient is around 22, 23 years old, and if the patient is around 40 years old. So 22, 23 is a good age once the number is stabilized. So the power is not increasing, and especially minus power. So these are the good criteria, good patients in which LASIK will be successful, and they will have life, what we call specs free life. So what we want is specs free life. So the lifetime in which they will be specs free will be more, because around the age 40 to 42, 45, we develop reading glasses. So glasses for near vision. So that again will not be specs free. If someone is getting operated at the age of say 35, 36, so the specs free life would be around only 4 to 5 years for someone getting operated in the late 30s. So age is a criteria. We would suggest a bit of an earlier surgery so that they have a longer specs free life. Secondly, we need to do 2 or 3 investigations. So the thinnest part of our eye, in which the front of our eye, that is known as the cornea. So that should be of an optimum thickness, and our most uh, hindmost part, that is the retina, that should be normal. So these two factors, we have our machines, we have our scans, we have our methods of checking this thing. So once we see that the all the criteria is being met, all the criteria is optimum, then the patient can go for surgery. So not every candidate is a very good candidate for LASIK. They need to meet that specific criteria, and again the power as well. So around -2 to -6 number of power of glasses, they do very well. More than -6, again they need to assess them. We need to see a lot many things. And okay, up to -10 also have been successfully removed. But again, it is a customizable approach. To each individual, it will be different. So that is better to consult and get the scans done, and then they can decide upon whether to go for it or not. It is not a very lengthy procedure, but yes, to the way we do the surgery, we would recommend that the patient can take care of their own self. It needs a lot of post-operative care. They need to use drops for a long time, maybe up to 6 months to 1 year sometimes. So all those things, if they are willing to do it, and yes, the success is quite good now with, like as I told you, the recent surgeries. So yes, more and more people are going for it, and yes, it is a good option. Many young people can get it done and get good results.
Okay, so how early can we start with this, Dr. Aditi?
Sorry.
How early can we start with the LASIK surgery? I mean, what's the
Early, see, the criteria we have is more than 18, adult, more than 18. And the number should be stable for at least 1 year. So suppose it has been seen in 2022, suppose somewhere in July or August, -3 hai, and then again next year it is the same. There's no increase. That patient is a good candidate for LASIK surgery. It should be stable and around more than 18. So around 2021 age is a very good age to get it done. That is the ideal age.
one?
Yeah.
Okay. And I mean, even after 18, can they get it? The children, just right after 18, they
Sorry,
can
Meg,
get
I
it.
can't hear your voice.
I'm saying that even
Yeah.
after right after they turn 18, they can go for it, right?
Yeah. If all the criteria is met, but generally that number stabilizes after the age of 20. What we have seen, sometimes there is an increase in number even after the age of 18. So we do wait, we would like to wait up to the age of 20 to be on the safer side, because the number, if it increases after surgery, that number can come back. I mean, again, the same problem that, okay, we got operated but still having specs. So we want that it should be, the criteria should be met in all aspects. So as to they don't have any remaining number, or they don't have any regression afterwards. So what happens after LASIK is, maybe 10 years, 15 years down the line, some people do develop a very minor number, maybe 0.5, 0.75, not needing glasses, but yes, it does occur in many cases. So we don't want that also to happen. So the criteria that we have been put for this LASIK surgery, it makes sure that the regression is less and there is no remaining power. So we should almost wait to 2021. That's a good age.
Okay, all right. What exactly do they do in the LASIK surgery, doctor?
So we generally use the laser power. It decreases the power of the cornea. So the most forward layer, that is the transparent layer. So they use the laser to make it a bit thinner. So that's why it should be an optimum thickness so as to not compromise the function of it. And the laser is applied on that layer, which then changes the whole surface of it. And then that accordingly, higher the power is, they need the kind of correction that we do. It is only done in that corneal part. So it is just the frontmost layer. So that, and then that the what happens is sometimes the patient has dry eyes because the tears are also on that same layer. So applying laser sometimes disturbs the tear film, but then it stabilizes with use of drops, sometimes up to 6 months. So that is the only most common side effect that happens. So just the anterior-most layer, not the whole eye. The whole eye is not touched, and only with laser. There is no other instrumentation involved.
That side effect goes after some time.
Yes, it does go. Most likely, it does go. Sometimes up to a year, and dryness is the main side effect that most of the patients face in this case.
So, I mean, it's safe to say that it's almost safe to go for the LASIK surgery when you have,
Almost,
but yeah,
yes, almost.
yes, of course, you are eligible. I didn't know that you had to be eligible for this operation.
Yeah,
So,
there is, so when people come to us and ask that, can we undergo LASIK? So, I have to tell them, explain the whole criteria first because it's not something that I can, prima facie, I can just tell that, yes, you can undergo or no, you can't undergo. So I have to, have a whole checklist ready. Okay, this is fine, this is fine. And then I can tell them that, okay, now you can maybe undergo. So yes, it is a very tricky and very complicated surgery.
can we call it a cosmetic surgery? Does that
It
come
is
under?
very much.
Oh, it is a
It is.
cosmetic. So then I just
Definitely it is.
if you are eligible for it or not because it's something
Yes.
it's not very medical but it's cosmetic. So of
Yes.
course there are certain pros and cons for it also. So that was very nice because most people want to know about LASIK surgery, want to get rid of their
Yeah.
glasses. Children these days, as you know, Dr. Aditi, are very prone to the power and the glasses. So most parents are worried and they almost rely on the process of LASIK because it's kind of uneasy carrying the glasses everywhere, and some
Yeah.
children might do it and some might not. So most parents are relying on this cosmetic surgery that their children will get rid of these glasses. So for clearing our doubts that it's almost true, but please audience remember only up to the age of 20 you must wait until then if you want to
Yes.
get a short successful surgery because then again you know do you think I mean you just said that it's good that we get the surgery as soon as possible but not if you get it in your late 30s or 40s it's not good it's like only for
Yeah.
4 5 years what is the science behind that does it reverse and the surgery does it reverse then
Sorry, I can't hear you. Is it reversed?
yeah I mean matlab, you said that after the age of 35 and 40 it's not very useful what is the science behind that how I mean does it reverse the surgery
No. What happens is that we get near vision glasses. So what I was talking about is that specs free life, the specs free time. So what would happen is that okay, we got the surgery done, but within 4 5 years, the person will develop reading glasses. So then they will have to use glasses for reading. So the LASIK is not very developed right now for the reading part. So the plus power that develops after the age of 40. So we don't have a very good it's still in the process of research and development. We are not able to remove that part of the spectacles that we need for reading. So that's what I generally don't recommend after the age of 35 because around 40 or maybe 42, 43, the glasses will come again. So that specs free time would be very less. So the person wants to enjoy the life without specs, but then again, once they turn 42, 43, oh God, again I got the specs. So, we don't want that kind of a, disappointment that, oh God, why have I got specs again? So that's why I generally recommend. Yeah,
Also wasted because how much does it
yeah.
cost? I mean, like approximately.
It's the cost is now almost, the starting is around 65,000 up to 1.2 lakhs now. It has gone, because they use a lot of infrastructure. The infrastructure itself is very costly, very expensive. So accordingly, the medicines and everything. So the cost is quite high, up to 1.2 lakhs in higher centers, in metros, Delhi or Mumbai. They are having these kind of rates right now.
All right, so that was very informative. And thank you, Dr. Aditi, for shedding light on so many things on the monster flu, on the LASIK surgery. So all of you audience out there who are, trying to get LASIK surgery, remember what Dr. Aditi just told you. And thank you so much, Dr. Aditi, for coming out, sparing
Thank
time for us,
you.
enlightening us with all the information that you gave us today. Thank you so much. It was such a pleasure to have
Thank
you.
you. Thank you so much.
Thank you, audience. Bye bye.